Headspace is an out-of-hours drop-in service for people approaching mental health crisis. The point of Headspace was to alleviate pressures on A&E, home treatment team, police, paramedics. So people that are in distress would come to us, where we would try and de-escalate and prevent then a trip to A&E or self-harm or substance use and suicide. I have worked at Headspace since last year. So when Headspace first opened in July, pretty much the whole month of July, August, we didn't have anybody attend the service. And then in September, we were getting an average of 3 people per evening, so that was 4 evenings per week. And now we get an average of between 7 and 12 people per shift, and we are open 5 evenings a week. And because of the increase in the amount of people, we will soon be a 7-day week service, and we're spread out across Plymouth as well, so that pretty much anybody should be able to get to where a Headspace shift if needed. Headspace point of view, so we were actually given £45,000 to run 4 shifts per week for the year. So, and that sounds a lot, but it's nothing, considering like staff costs and all of that sort of stuff. And then because the numbers have increased so much, and we can see the savings that's being made within the NHS, they then come back to us and said, this service needs to run more. We're going to find some more money because of what they're saving elsewhere. They're kind of going to put back into us. So hence why we're soon to be a 7-day week service. So that's good. Our figures show that we have more men that access Headspace than women. By quite a bit. So at the moment, when we did a shift last time, there was about 12 people there. 8 of those people were men. We have some regular service users that are all men as well, so they will come to every session. Got lots of statistics and stuff to show that. We gather feedback as well, so we've got lots of sort of testimonies from service users, and we make notes of people when they come in, of their reasons for being there and what would they have done had they not gone to Headspace. So we're able to see how many people said they would have actually committed suicide, how many people would have gone to hospital, how many people would have self-harmed. And it's quite significant, hence the reason they've all of a sudden found some more money to make the service grow. We've actually, we have had police bring somebody that they'd got down from a bridge to Headspace because they were really not wanting to go to hospital. So it was kind of like, let's see if we can help before doing that. And fortunately, we were able to help the person, which meant they didn't go to A&E. The police actually took them back to his wife and his baby, and so that was really good. We've actually had a few people that have made preparations to commit suicide, written letters, and have sort of come to Headspace as a kind of last attempt of being helped, and we have been able to help people, so that's really good. We've also got quite a few service users who have, because of the way mental health is at the moment, there's not enough CPNs, there's not enough counsellors, there's not enough of anything, so Headspace for a lot of people is the only support they've got. So we've got quite a few people that come to us on a regular basis, and we kind of help to maintain them to be in the community rather than declining and then ending up being sectioned and in hospital. I think there's more awareness towards the younger generations of people as well. I think with the generations that are coming up through, it's definitely a lot more accepted and going to be a lot more talked about, and there seems to be lots of campaigns and stuff to raise awareness. So yeah, I think it is changing, but I think there's quite a way to go yet. But it definitely is changing.